If we don't have good blood flow to our legs and our feet, we wind up actually having serious problems with walking, and it actually even gets worse. If we don't have enough good blood flow to our feet, actually our skin will actually open up and we'll actually have wounds that can actually not heal, become infected, get gangrenous, and it can lead to amputation. So I'm a medical doctor. I can tell you that I work in this space, vascular space of blood flow. And one of the things that we really focus on is making sure that all of our organs and all of our tissues, including the bones and muscles and skin of our legs, actually have good blood flow.
For seniors, maintaining healthy blood flow to your legs is absolutely critical. Poor circulation can result in leg pain and weakness, slower wound healing, an increased risk of infections and ulcers, and, if untreated, higher chances of amputation. So ask yourself this: do you often experience leg cramps, tingling, or swelling? Well, it could be a serious circulation problem that increases your risk of heart disease, stroke, or even amputation. According to medical research, millions of people suffer from circulation issues, but most ignore the early signs until it's too late. Dr. William Lee breaks down what could be happening in your body and how you can fix it before it gets worse.
If you have narrowing of the arteries, atherosclerosis, due to high blood cholesterol, high lipids, if you actually have hypertension, high blood pressure, hardening of the arteries that comes from smoking and vaping, damaged blood vessels from conditions like diabetes, all of these things can actually compromise blood flow to your leg. Your heart is the source of pumping blood for the rest of your body, including your legs and your feet. If you want blood flow down to your big toe, your heart's got to be working really well to pump that blood. So cardiovascular health, having good heart health, is the beginning of actually having good circulation to your legs and frankly anywhere else in your body. So number one, having good heart leads to good blood flow. Having healthy blood vessels is really important, and also having really good nerves to your feet are also important as well.
Your body relies on healthy blood flow to deliver oxygen and nutrients to your muscles. But when circulation slows down, your legs don't get the oxygen they need, leading to cramps, weakness, swelling, and even nerve damage over time. So what's causing it? According to Dr. Lee, there are 4 major culprits that are blocking your circulation and making your leg health worse.
I'm a vascular doctor. I study blood vessels. I know a lot about what it takes actually to improve blood vessels. You can have surgery and bypass. You can have stents to open up the blockages. But one of the things that you can actually do is to have lifestyle changes that can make a big difference.
Dr. Lee's 4 circulation killers you must avoid. Number 1, alcohol. First, Dr. Lee warns to cut back on alcohol.
Alcohol is a toxin. Alcohol is hard on the blood vessels. Alcohol stuns your stem cells that are needed to be able to rebuild blood vessels. And so when you drink a lot, you actually make it harder for your legs to maintain their circulation, particularly if blockages. That alcohol just kind of rips the rug away and makes it much more difficult to actually repair and maintain that circulation.
Alcohol dehydrates your blood vessels, making them narrower, which reduces circulation, especially in your legs. Studies show that excessive alcohol intake can lead to inflammation of blood vessels, making it harder for your heart to pump blood efficiently to your extremities. Number 2, salt.
You don't want to eat too much salt.
The second thing you should avoid is sodium overload.
Salt tastes great, but guess what? Salt is really, really hard on our blood vessels. If you want an analogy, it's kind of corrosive to our blood vessels. You know salt on the road, how tough it is on the road surface? And so after a tough winter with a lot of salt on a road, you get potholes. Well, that's basically what happens when you have too much salt in your bloodstream. You wind up accumulating a lot of fluid, you get hypertension, and then the lining of the blood vessel gets damaged by the high salt environment. When the lining gets damaged, the lining starts to be more sticky, and when cells stick to the lining and lipids, fat, cholesterol sticks to the kind of like corroded surface of the blood vessel, guess what? Blood vessel narrows. When blood vessels narrow, you get less circulation. So don't eat too much salt. Cut down or cut out salt. Get the low sodium version.
Salt causes fluid retention, leading to swollen ankles, tightness, and painful leg cramps. According to the American Heart Association, a high-sodium diet can cause stiff arteries, which makes circulation sluggish and increases your risk of blood clots. Number 3. Ultra-processed foods.
Now, we know ultra-processed foods is connected to so many chronic diseases, but the one that I really want to talk about is atherosclerosis, right? So you wind up actually having more lipids, more narrowing of the blood vessels, too much salt, which, as I said just now, corrodes the inside of your blood vessels, and ultra-processed foods sets up for type 2 diabetes, metabolic syndrome, and type 2 diabetes. And diabetes is a condition that's well known to damage your circulation.
If your diet is full of fast food, chips, or sugary snacks, it's time for a major change. Ultra-processed foods are loaded with artificial additives, trans fats, and refined sugars, which cause inflammation, blood vessel damage, and poor circulation. One study found that a diet high in processed foods can increase the risk of peripheral artery disease, PAD, a condition that reduces blood flow to the legs and feet. Number 4. Smoking and vaping.
You should stop smoking, stop vaping, because the nicotine actually damages your blood vessels, makes it harder, and it increases atherosclerosis. And vaping actually is even worse, all right? So smoking cigarettes, cigars, pipes, vaping, no, don't do it.
Dr. Lee advises quitting smoking and vaping. Nicotine shrinks your blood vessels, making it harder for oxygen-rich blood to reach your legs. Research shows that smokers have a 2 times higher risk of developing poor circulation-related diseases like PAD and chronic venous insufficiency.
And if you're somebody who is, let's say, in their middle age or older, and you already have bad circulation, you smoke and you vape, you're making everything an order of magnitude worse.
According to Dr. Lee, you should also get your lipids checked.
Blood lipids are what sticks to the side and narrows up your blood vessels. So if you want good leg circulation, you need to get your blood lipids under control.
If you have high LDL cholesterol, your blood vessels become stiff and blocked, leading to poor leg circulation and a higher risk of heart disease. Now that you know what's harming your circulation, the next step is fixing it with the right foods.
Research I've done has shown that good, healthy gut bacteria can actually help heal your blood vessels and heal wounds as well, improve circulation. We found that one bacteria called Lactobacillus reuteri, which is part of a healthy gut bacteria, we did lab research and showed that if you actually give experimental animals Lactobacillus reuteri, you can actually speed up wound healing, improve circulation, decrease inflammation. These are all really important things if you have compromised blood flow in your legs. So what else can you actually do to actually improve gut health? Well, I'm going to tell you some of the foods that actually can improve your gut health and also improve your circulation.
In our next video, we'll reveal the top 10 foods to improve leg circulation and prevent leg cramps. So make sure to subscribe to the channel so you don't miss it. If you found this video helpful, hit that like button and share it with someone who needs this information. Leave a comment below if you experience leg cramps or poor circulation. Let us know how you manage it.